Hi, could it surprise you to learn that male infertility is as prevalent as female infertility today? One significant cause is a condition that is known as azoospermia, zero sperm count. Does it sound bad? Don't worry. Azoospermia, also called as zero sperm count, is when no sperm is observed in the semen. It could arise from obstruction in the reproductive channels or even issues with the sperm production. Symptoms are very rare, and zero count is known only when couples start investigating the reason for not conceiving naturally. Though sometimes symptoms can include a decrease in libido, erection difficulties, or swelling around the testicles, making it a leading cause of male infertility. Let's consider the story of Ravi, an ambitious entrepreneur, frustrated by his inability to father a child. He felt depressed and experienced a drop in self-confidence. For Ravi's emotional turmoil, we utilized a homeopathic remedy called ignitia that is commonly used for emotional distress. It helped him and his wife in conceiving naturally. Azoospermia can be divided into two types, obstructive and non-obstructive. Obstructive azoospermia occurs when there is a blockage in the vas deferens, that is the tube that carries sperms. Non-obstructive azoospermia relates to difficulties in sperm production. Importantly, the distinction between obstructive and non-obstructive azoospermia is vital in determining the mode of treatment. For obstructive azoospermia, the blockage needs to be bypassed or cleared. In the case of non-obstructive azoospermia, treatment is more complex and may involve stimulating the testes to start producing sperms or even resorting to the use of donor sperms. Even though both types of azoospermia pose considerable challenges, recent advancement in medical sciences and the advent of holistic form of treatments like our very own homeopathy assisted reproduction therapy offers potential solution and hope for affected individuals. Now, let's see a case of Mr. Amit, a gifted musician grappling with non-obstructive azoospermia. His fear and anxiety were palpable. A homeopathic remedy, Argentum nitricum, known for male issues and even managing anxiety and impulsiveness, was Amit's path to relief and natural pregnancy. Unlike conventional medicine, homeopathy assesses the individual holistically, taking into account physical condition, emotional state, and mental health. And that's why it is effectively able to address conditions like zero sperm count. To confirm a diagnosis of azoospermia, we do few tests. The first one is semen analysis. This is the first test to determine the presence of sperm in the semen. The patient is asked to provide a semen sample which is then analyzed in a lab. If no sperm is detected, the analysis is repeated to confirm it. Then we do hormonal testing. Blood tests are conducted to check the levels of various hormones, including testosterone and FSH, that is follicular stimulating hormone, which play critical roles in sperm production. Rarely, we may need genetic testing. Now, certain genetic disorders can cause azoospermia. So, genetic tests such as karyotyping and Y chromosome microdeletion testing can help identify if a genetic defect is the underlying cause. This may be followed by various imaging tests, especially ultrasound or MRI can be used to check for any blockages or structural abnormalities in the reproductive system of the man that might be causing obstructive azoospermia. Testicular biopsy is also done. In some cases, a small sample of tissue may be taken from the testicles to check for sperm production. This is usually done if non-obstructive azoospermia is suspected. This test not only confirm the diagnosis of azoospermia but also help in to determine its type, obstructive or non-obstructive, guiding the appropriate course of treatment. Finally, let's see a case of Samir. He was an IT professional battling high stress levels and obstructive azoospermia. Naxwamika, known to manage stress and rejuvenate energy and also work for various male issues, was his treatment. His wife conceived naturally in 7th month of his treatment. Let's be clear, azoospermia doesn't signify the end of your hope for a natural pregnancy. Take Ravi, Amit, or hundreds of other males who are now a proud father. They seized the opportunity, so why shouldn't you? Dial the number on the screen to book a pre-treatment assessment with our specialist. And remember, every second matters. This may be the turning point you have been waiting for in your fertility journey. That's all for today. See you in my next episode. Bye and take care.